Dr. Jeff Harp from Highland Family Medicine is back with us this morning. Doctor, good morning.
Good morning.
I want to ask you about a study that came out about 2 weeks ago in the journal Brain describing neurological symptoms in patients with COVID-19. What did this study reveal?
Well, this study is not exactly a study. It is the results of conversations had by a group of neurologists in England. They basically met weekly to discuss the emerging spectrum of neurologic disease that was happening in patients with COVID-19 disease.
What are they seeing? What did the doctors see?
Well, there are multiple kinds of conditions being seen, actually. So everything from brain dysfunction to brain inflammation that causes the brain not to work well, something like Guillain-Barré syndrome, to peripheral nerve problems like we might think of carpal tunnel, to strokes. So there's a whole wide range of neurologic diseases that can occur. Some a week before people develop other symptoms, some a month after they develop the classic respiratory symptoms. So we're just beginning to understand this.
Well, and that sort of raises the key question. What does this mean for our understanding of COVID-19?
Well, it reminds us again that we're just starting to learn about this illness. It's only been around for 6 months. The thing we know the most about is the early symptoms and the management of the acute, severe respiratory complications. That's the thing that we first started dealing with, and we understand probably best how to handle that. But there's many other symptoms, like the gastrointestinal symptoms, the neurologic symptoms, some of which are occurring without the respiratory symptoms, and some of which are occurring much later in the course of the illness after the respiratory symptoms are gone. It seems to have distinct phases, some of which aren't always present, like this acute inflammation phase that you've been hearing that especially affects children, but adults too. The sticky blood that goes along with that is causing strokes and blood clots. It really tells us that this is a new disease that we don't know that much about, and after 6 months, it's normal not to have a full understanding. Just like when any new disease appears, you might remember H. pylori disease, AIDS. We didn't know that much about them at first, and it took a while to begin to understand what the disease really was all about.
All right, as this understanding evolves then, does it change the steps we should be taking to keep ourselves and our loved ones safe? Occasionally,
the information that we get causes us to rethink the basic guidelines about protecting ourselves and our loved ones. And we see that reflected in the recommendations that are made. So that can become frustrating, like now we got to do this, now we got to do that. But basically, there's been no change in the major things that we need to do: masking, social distancing, and excellent hygiene. Those things remain the same and are really the cornerstones to preventing the spread of the disease and to protecting ourselves and our loved ones.
All right, doctor, we will leave it there. As always, thank you for your time. We appreciate it.